I'm the Helen Ross Professor of Social Service Administration at the University of Chicago and a blogger here. And how about yourself?
I have several positions, one of which is at the VA hospital in Jamaica Plain, that's in Boston, Massachusetts. I'm a health economist in the VA, and I also have a position at the BU, Boston University School of Public Health and School of Medicine, where I'm an associate professor. And I'm a blogger.
And I should say we blog together. And congratulations, by the way, on your promotion. It's not incredibly recent, but congratulations anyway.
Thank you.
So why are we talking today?
Well, I thought we'd talk about the recent proposal by 8 scholars, many of them health economists, but I think there's a doctor in the mix and maybe a few others, that was unveiled at the American Enterprise Institute last week. And it's a health reform proposal that actually has a lot of similarities to the ACA, but some important differences. And I think I'd like to talk a little bit about what I found positive, encouraging, and interesting about it. And then I know you and I differ a little bit on one key point that I'm sure we'll get to.
Yeah, pretty much like the fact that I hate it. Yeah.
Well, I actually think you don't hate many of the principles. What I found kind of remarkable is that I don't know the 8 scholars all well, but I know that they span the political spectrum, maybe not end to end, but they do cross over the center. So there's left and right represented, and they managed to agree on several key principles that I think you and I both share, and many others, namely move toward or actually achieve universal coverage. Um, Address the two-tiered nature of the system by dealing in some sensible way with Medicaid, deal with or approach the efficiency problem in the healthcare system, and pretty notably remove or deal with the tax preferential tax treatment of employer-sponsored health insurance. I think there's many other provisions, some of which I know you've mentioned, but I've slipped my mind, that are generally agreeable, to a wide range of people. And what I find interesting is not just that they laid out these principles that many of us can agree on, but that the fact that they all seem to have agreed on the premise that that we should be addressing these problems in healthcare. And that's the idea that we should be working toward that goal. I don't think is universally held, or at least not evidently so by everybody. And so we have a lot of fighting about the Affordable Care Act that I think is born out of basically a disagreement on whether we should be doing something at all. And that I thought was encouraging, just that they just said, no, we really should be doing something, and here are the principles that we're going to follow. Now those principles lead to some specifics that I think we'll get into that we may disagree on.
And I should say there are some points that I think at least health economists basically all agree on, and actually the people who wrote the Affordable Care Act would agree with too, although when it gets to the politics it's a little different because of course ACA is an actual law that had to get through the legislative process. So I think almost all health economists, and maybe nobody else, basically agree that we should do something about the large and regressive tax expenditures for employer supplied health insurance. And I think for many people watching this, you may say, well, that's a bad thing because my employer is giving me health insurance and you would want to tax me on it. First of all, that's not free. The government pays and workers pay when health insurance is very generous. And also people like you and I who earn higher incomes than the average benefit a lot more than other people from these sorts of tax expenditures. And this, if we could free up some of that money that's being given at the top end of the income scale, we could do a lot of things to help people with modest incomes and still make the budget numbers work. And I think almost all health economists think we would make better use of healthcare dollars, and we would free up resources that we could use to help the needy if we did things. And the ACA has the Cadillac tax, which goes some direction to do that, and which is an admirable thing. But they would like to do more.
But just to throw out one number, and I was surprised to learn this, but a while back a colleague and I did this calculation, but the actual amount of assistance that we receive through this tax subsidy per person who receives it is not that far from the average cost that a Medicaid beneficiary receives. It's in the $4,000 to $5,000 range. on average. Not that we all receive that amount, but on average, that's what it is.
I'm
So
sure I'm sure you and I receive more money in tax expenditures than the typical healthy Medicaid recipient receives.
that's right. So it's huge, and you and I, frankly, and many others certainly don't need the help, not relative to many others.